Hello, 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 everyone. This is Dr. Nicole, board certified family physician. I'm going to wait a little while, let some folks come on and join the broadcast today, all right? It is Sunday, August 6th. It is 3 p.m. Please like my page and share this video. Share with your friends. It is a very important topic that we're going to discuss today. We're going to talk about Mr.ED and not the talking horse. All right. So I'm going to wait a few moments and let some folks join in. Let's see. Let me swipe so I can see who joined in. All right. I'm just going to share from my phone here just so we can get some more folks to come on in. When you come on in the room, please say hi so I can know that you're here and know that you're, so I can say hi and know that you're here. Let's see, I'm trying to figure out how to do this here on this iPad. It's not showing me who my viewers are. Oh, how's everybody on this wonderful Sunday? Go ahead and say hi so I can know who's here. Let me know who's here. I'm Dr. Nicole, your board certified family physician, and today we're going to talk about erectile dysfunction. I am going to wait another 1 to 2 minutes just to allow some folks to come on in. Please share this video. Sharing is caring. It's a really important topic that we're discussing today, and you're going to want to learn more about it, okay? I want to open this up for questions too, so invite your friends to come in so they can learn also about erectile dysfunction, the 7 top reasons why people have erectile dysfunction and what they can do about it, all right? So please invite your friends. Sharing is caring. I'm happy to be broadcasting with you on this beautiful Sunday. Beautiful Sunday. We're going to call these sessions on Sunday afternoons Talk with the Doc, all right? It's really important that people are able to talk with their doctor. And people a lot of times say that, you know, they go to their doctor, but they aren't able to talk. Hi, hello, whoever just came in. Please post and say hi so I can know you're here. It's very important that people can talk with their doctor, because the doctor, we're fighting for your lives here, and we're a team, so we got to work together to educate you and to get you healthy so that you can be around a long time for your kids and your kids' kids, your communities, everyone. All right, let me see if I can see who my viewers are. It's still not showing me, but that's okay. I'm gonna wait 1 more minute, let you share this video so that people can come in. Come on in the room. All right, please share this video. Sharing is caring. It really is. All righty. Like I said, today we're going to talk about the big ED and not Mr. Ed the talking horse. We're going to talk about ED, that's the erectile dysfunction. All right. Wait just a few more seconds and we're going to get started. Does everyone have a busy week planned? I'm sure you do. But I'm glad you're here with me today. All right, just a few more seconds and then we'll get started. I really want people to come in. I want to be able to answer your questions. Just gonna leave a test comment here so I can see. If it's showing up today. Ah, it's showing up. Okay, good. So if you leave a comment, I will be able to see it, okay? So please leave a comment when you come in so I can know that you're here, so I can acknowledge you, okay? All right, well, I'm going to go ahead and get started. It's 3:07 on Sunday, August 6th. I'm Dr. Nicole. You all know who I am. I'm Dr. Nicole, your board certified family physician. I specialize in treating and preventing chronic medical conditions and educating everyday people about those conditions in terms that they can understand. Through my books, my programs, my seminars, and through my concierge medical practice, I help pastors, congregations, and everyday people live their best lives, transform their mind, body, and spirit so that they can impact the lives of their community, their children, their congregations, and everyone around them. Please join me on Facebook, www.facebook.com/Dr. Nicole D.O. That's DrNicoleDO for more information. And please join me on Sunday afternoons at 3 p.m. Eastern Standard Time for the Talk with the Doc session. All right, so let's get started. We're going to talk today about erectile dysfunction. What is erectile dysfunction? Also known as impotence. That's IMPOTENCE, impotence. So that's erectile dysfunction. Erectile dysfunction is basically the inability for the penis to maintain an erection that is sufficient enough for penetration or for sexual intercourse. So some guys can get a slight erection, but it's not sufficient enough for intercourse, then that means that they have erectile dysfunction. So there are lots of people that have erectile dysfunction. Lots of people. There's over 3 million people in America. Hello, whoever just joined in. I can't see who you are, so please leave a comment, say hi. 3 million people in America have erectile dysfunction. So it's a very common problem that we're dealing with. I just want to read you some statistics on erectile dysfunction. Join in. Here's some statistics. They say that approximately 10% of men aged 40 to 70 have severe or complete erectile dysfunction, which is the total inability to achieve or maintain erections. And then they say that 25% of men in this age category have moderate or intermittent erectile difficulties. So that's just a difficulty, maybe not complete, but just some difficulty with achieving an erection that's hard enough or sufficient enough for intercourse. They say that by age 70, those numbers rise up to 49%. 49%, that's half of men by age 70 have erectile dysfunction. So this is a very, very common occurrence. So it's so important to learn about it, what it is, why it occurs, and what we can do about it, okay? Hey there, Dr. Ebony, how are you? Thanks for joining in. So now that you know what erectile dysfunction is, the inability to achieve an erection hard enough for intercourse or sufficient enough for intercourse, and you know how many people have it, over 2 million people in America, 3 million people in America have erectile dysfunction. Now we're going to get into the why do people have erectile dysfunction. So there are 7 main causes for erectile dysfunction, and we're going to hit each one of those today, okay? So there may be one of the main causes, and I see this a lot in my practice, are psychological issues. So whether that be stress, depression, anxiety, marital difficulties, financial difficulties. There's something called Maslow's hierarchy of needs. And what Dr. Maslow did back when he wrote his hierarchy of needs, he made a pyramid and he listed what people need. And so at the basic needs are things like food, shelter, clothing, basic needs. So as you go up the hierarchy of needs, pleasure, including sex, is kind of at the higher portion of the tier. So people are not going to be able to enjoy and have pleasurable experiences such as sex if their bottom needs are not being met. So their basic needs. So if you're struggling to eat, if you're struggling on how you're going to pay your bills, if you're having a lot of stress in your life, if you and your spouse are having trouble, then you're going to have some trouble psychologically with erections. And that we see is a major problem, because erectile dysfunction has a big impact on marriages and relationships. We see that a lot of times, that some women can assume sometimes that either their husband or their spouse is being is going through infidelity, when a lot of times men are just kind of embarrassed, so they want to have less intercourse because they're embarrassed that they are not able to get the erection like they used to be able to get. Okay, so psychologically, if you're not having your needs met psychologically, then you can have problems with the erectile dysfunction. Okay, so the next problem that we see, these are all organic problems and causes, are vascular causes. So the way that erections work, you have arteries that go to the penis, and those arteries fill with blood. When the arteries fill with blood, that engorges the penis and it makes it erect. So if there are problems with blood flow and the blood can't flow to the penis the way it's supposed to, then you can't get the erection. So what causes the problems with the blood flow? Lots of different things. One of the main ones that we see is atherosclerosis. That's a big word. Atherosclerosis basically means plaque in the arteries. I'm sure you've heard that term before, dealing with plaque in the arteries, like in your neck or in your heart or in your brain. Those lead to heart attacks and strokes when you have plaques in your arteries there. So that's the other reason why erectile dysfunction is also a risk factor, or it's a sign, or can be a sign, that there might be some blood flow problems, some plaque in the arteries, and that can be a key that you might need to go and get that treated, because that can also lead to heart problems, coronary artery disease, carotid artery disease, blockages in the brain as well. So you want to check and make sure that it's not a blood flow problem because of plaque in the arteries, okay? The other blood flow problem that we see is diabetes. So when you have elevated blood sugar with diabetes, that makes your blood thick. And when your blood is thick from sugar, then it can't flow as easily as it needs to flow to the penis. When it can't flow where it needs to go, then what you get is erectile dysfunction. So you're not able to get that erection. A lot of times when the men come in my office and they say that they're having problems with erectile dysfunction, first things that we'll check is their sugars. Where is your sugar levels? If your sugars are too high and your blood flow is not flowing where it needs to flow, then we know that that definitely can cause some erectile dysfunction, okay? So other things that can lead and worsen vascular disease is smoking, tobacco. We know that tobacco can cause hardening of the arteries and plaque in the arteries as well. So if you are a smoker, you have a higher risk of having erectile dysfunction as well. Hello, come on into the broadcast. Welcome, welcome. So you want to not smoke, okay? Because smoking can lead to erectile dysfunction. It can be one of the risk factors for having erectile dysfunction. Also, cholesterol, high cholesterol, can also clog the arteries, and when the arteries are clogged, the blood can't flow, and that can result in erectile dysfunction. All right, so there are also some neurologic problems that can cause erectile dysfunction, such as neurologic disorders. You know, if you've had a stroke, if you've had Parkinson's disease, multiple sclerosis, if you've had trauma to the spinal cord or to the brain, then that can also cause neurologically, the nerves aren't working and can't help with the erections also, okay? Also, there's endocrine problems, and endocrine problems mean those are your hormone levels. So a lot of times, especially with the younger guys, if you're having problems with erectile dysfunction, and we've seen that, you know, we've ruled out the stress, you're not having any stress, your relationships are okay, you're doing okay with your stress levels, your needs are being met, we've checked your sugars are normal, we've checked your cholesterol is normal, we've checked your blood pressure is normal. The next thing we would look at is your testosterone levels. Are your testosterone levels low? Even in young males, we can see low testosterone, and low testosterone can lead to erectile dysfunction, problems with libido, or that's your sex drive, so you can have decreased sex drive. So also if you have thyroid problems, if your thyroid levels are too low, that can also lead to erectile dysfunction, all right? So you want to make sure that your endocrine system is ruled out as a cause for erectile dysfunction. The next problem that we see is penile issues. So if you have problems like Peyronie's disease is the buildup of scar tissue in the penis that causes a curvature to the penis. It can be very painful for men. It can have problems with erections as well. So if you've got Peyronie's disease, that can be a cause. If you've got priapism is having an erection for more than, for a prolonged erection, usually more than 4 hours, is considered priapism. Also penile trauma. So if you've had trauma to the penis, that very much can cause some erectile dysfunction. Hello, welcome to the broadcast. All right, so the next cause is medication induced. So we do know that there are over about 200 different medications. Hi everybody, welcome to the broadcast. Please share with your friends. Sharing is caring. We know that there are over 200 medications that have listed erectile dysfunction as a side effect, as a possible side effect, okay? Some of the ones that are most common that come to mind are some of the SSRIs, that's the selective serotonin reuptake inhibitors. Those are the medications that we take for depression, anxiety. Sometimes they take them for insomnia. So some of the SSRIs can cause erectile dysfunction. I see a lot of gentlemen, especially ones who are being treated for like PTSD, and again, depression, anxiety, they have problems with erectile dysfunction. Other medications that can cause erectile dysfunction, some of the blood pressure medications, unfortunately, the ACE inhibitors can sometimes cause some erectile dysfunction, and that's the thing, it can sometimes cause erectile dysfunction. It doesn't mean that if you take those pills that you are going to have erectile dysfunction. So please, 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 if you are on any of those types of medications, please continue to take your medications, but you'll want to talk with your doctor about if there's anything else that you can do to treat the erectile dysfunction. Hey, Miss Yvonne, how are you? Thanks for joining in to the broadcast. Please share with your friends. All right. So medication induced. So like I said, if you are on those medications, please take your medicines. Please, please, please take your medicines. But what you can do is to work on the lifestyle modifications to help prevent the erectile dysfunction or to help worsen the erectile dysfunction, okay? So if you have to take those medications, the SSRI or some of the ACE inhibitors or some of the other medications that we know can contribute to erectile dysfunction, you'll want to make sure that you are living a healthy lifestyle. So managing your stress, not smoking, not drinking alcohol, not taking drugs. Those are the things that you can control that can also help with the erectile dysfunction. All right. We also know that there are some operations that are usually necessary for your health, but that can have the result of erectile dysfunction. So operations to the prostate, such as treatment for prostate cancer, if they have to go in and remove the prostate, sometimes that can mess with the blood flow, it can mess with the nerves, it can result in some prostate in erectile dysfunction. So we do want you to get those operations though, but just know that sometimes the operations, and your doctor will, your surgeon, your urologist will discuss that with you if those operations carry the risk of erectile dysfunction, okay? On those same lines, prostate cancer in general can also cause some erectile dysfunction. Remember we talked about last week, the prostate is right there, right inside the rectum, and it has the urethra going through it, and there's nerves going through it, blood vessels going through it, that all lead to the penis. So if you've got problems or prostate cancer or problems with the prostate, that definitely can cause some erectile dysfunction. All right. So let me just list those one more time. What are the reasons why we have that men have erectile dysfunction? Well, like I said, age. So the older you get, the higher the risk of having it. If you're a smoker, if you have plaque in your arteries, if you have diabetes, if you have hypertension or coronary artery disease or problems with vascular supply or blood supply, that can cause some erectile dysfunction. If you've got some psychological issues, you've got some depression, you've got some anxiety, you've got marital issues, you've got some financial difficulties, if you've got performance anxiety, you know, before a sexual intercourse, if you're scared to perform, that definitely can cause some erectile dysfunction, all right? We know that there are over 200 medications that list erectile dysfunction as a possible side effect or possible, that can cause some erectile dysfunction as well, okay? There are operations that you can have. Hello, welcome to the broadcast. Thanks for joining in. Please share. We know that there are some operations that can cause erectile dysfunction as well, okay? hormones, if you have a lack of testosterone, or if you are low in your thyroid levels, we know that that can cause some erectile dysfunction. If you've got some neurologic issues, if you've got multiple sclerosis, if you've got Parkinson's, if you've had a stroke and it's affected the nerves that go to the groin or to the penis, we know that that can also cause some erectile dysfunction. All right. We also know that prostate cancer or issues with the prostate can cause some erectile dysfunction. And then injury or penile problems like Peyronie's disease or priapism can also cause some erectile dysfunction. All right, so what can we do about the erectile dysfunction? Well, treatment for erectile dysfunction, there are lots of medications that are out there. But before we jump into medications, let's talk about what you can do naturally to help with erectile dysfunction. Like I said, if you drink lots of alcohol, if you smoke cigarettes, if you're not exercising, if you're under a lot of stress, those all can lead to the erectile dysfunction. So by stopping smoking, by getting more exercise, by limiting your alcohol intake, by eating a healthy diet, those can all improve erectile dysfunction by improving the blood flow to the groin, to the penis, and then you wouldn't have as many problems with the erectile dysfunction, okay? Psychosocial treatment. So if you are having some psychological problems, some depression, some anxiety, some PTSD, some marital issues, if you're having any of those psychological issues, certainly going and getting those issues dealt with a therapist, with your doctor, can definitely make a difference and can help with the erectile dysfunction, okay? Behavior therapy is another one that can help as well, all right? Then, so also making sure that your sugars are low so that you don't have diabetes, or if you do have diabetes, that it's well controlled. Make sure that your blood pressure is well controlled, making sure that your cholesterol is well controlled so that that blood can flow where you need it to flow, okay? And where we want it to flow in this case, guys, is to the penis, so that you can have good erection that's good enough for intercourse, okay? So once you've tried all of the natural causes, then there are some medications that the doctor can prescribe you if the doctor prescribes them, okay? Because the doctor needs to go over your history. The doctor needs to know what other medications that you're taking. They need to know what medical conditions you have, what operations you've had, because we need to know all of those things in order to know if you are healthy enough and if your body can take the medications for erectile dysfunction. So if you're taking a nitrite for your heart, a dinitrite or a nitrate medication for heart disease, for congestive heart failure, then you actually cannot take the medications for for erectile dysfunction, okay? So don't just go online and go order the pills or get some pills from your friends without a doctor knowing, going over that with you and making sure that you are healthy enough, A, for sexual intercourse, and B, healthy enough to take the medications that we can give you for erectile dysfunction. Now, those medications, I'm sure you've all heard of them. Cialis is a medication. Viagra. Viagra is a little blue pill I'm sure you've heard about. Cialis, I believe, is a little orange pill. There's another one called Levitra. So those are the main three medications that we prescribe for erectile dysfunction. Again, your doctor needs to prescribe those. Please don't go online. Don't go to the pharmacies overseas to purchase those without a doctor knowing that you're healthy enough and that it's safe to take those medications, all right? So let's just say you can't take the medication either. Let me also just say that those medications are very, very expensive, and that insurance does not cover those medications because it is for pleasure, okay? So insurance would say that it's not a medical necessity, although, guys, I'm sure that you feel like it is, but insurance companies don't feel like it's a medical necessity, so insurance companies most times will not pay for the erectile dysfunction medications. So you're going to come out of pocket. Some pills can be as expensive as $40 a pill, okay? So it can be a pretty pricey pill. They say you got to pay to play. All right, so if you can't take those medications, if you can't afford them, or if you're on nitrates or nitrites and you can't take those medications, or your doctor has said that you should not be taking the erectile dysfunction medications, there are some other treatments that you can get to help treat erectile dysfunction. There is an implant that can be placed into the penis, surgically, of course, and the implant keeps the penis at a slight erection. The erection is sufficient enough for intercourse. It's not so much of an erection that you're walking around uncomfortable all day, but it is an erection that can help with intercourse. So that's an implant that can be surgically implanted into the penis. All right, so there's also penis pumps that can be used. Those help to increase the blood flow to the penis and can help to engorge the penis with that blood flow so that the penis can be hard enough and sufficient enough for intercourse. All right, so a penis pump, it's not a joke, it's a real thing, it's out there. You can get those. A doctor can write a prescription for you for a penis pump, or you can get them from stores as well. All right, and last but not least, okay, so there's also pumps that can be surgically implanted into the thigh, and you literally pump up the pump, and it pumps up the penis. All right, so those are pumps that you can use to help with erectile dysfunction as well. Those would be surgically implanted, and so you would need to go to your family doctor or to your internal medicine doctor, and they would refer you to the urologist, and then the urologist can get those things implanted for you. All right, so that is erectile dysfunction in a nutshell. It can be kind of a touchy subject, I know, for men to talk about. A lot of times it's the last thing that they want to bring up at a doctor's appointment. We'll see a lot of other reasons, per se, for why they came in for their appointment, and that's always the last thing they want to talk about. Oh, doc, one more thing, as they're walking out the door. We often know what that means. But guys, don't be afraid to talk with your doctors. You've got to be able to talk with your doctor. And you need to have that relationship with your doctor where you feel comfortable enough that you can bring up those issues and any other issues that you have with your doctor. All right, and if you can't talk with your doctor, then maybe you should see about getting another doctor who you can have and develop a rapport with, and so that you're able to talk with difficult subjects like erectile dysfunction. All right, so to recap, erectile dysfunction, lots of people have it. There are lots of reasons why, from age to smoking to blood flow to diabetes to hypertension to other high cholesterol, psychological issues, medications, hormones, neurologic problems, prostate problems, injuries. And for treatment, you can limit your smoking, stop smoking, limit your alcohol intake, eat a healthy diet, increase your exercise, and then you can get medications prescribed to you from your doctor. And if the medications aren't working, then there's also, you can go and get a surgical implant or a pump. And then there's also the pumps that you can try. All right, guys. Thanks for having this talk with me today. If you do have any questions about erectile dysfunction or any other medical issues, please go to my Facebook page, www.facebook.com/Dr. Nicole D.O. That's DRNICOLEDO. Leave me your questions, your comments, and we can discuss this at a later date. You know that I'm coming on every Sunday afternoon at 3 p.m. for your Talk with the Doc session. Again, I'm Dr. Nicole, your board-certified family physician. I specialize in treating and preventing chronic medical conditions and explaining those conditions in everyday terms to everyday people in terms that they can understand. Through my programs, my books, my seminars, and my concierge medical practice, I help pastors, their congregations, and everyday people live their best lives and transform their mind, body, and their spirit so that they can have a greater impact on their communities, their children, and the people all around them, their congregations and everyone around them. All right, I'm Dr. Nicole, and I'm so glad that you came in and joined with me today. Please follow me on Facebook, www.facebook.com/Dr. Nicole D.O. DRNICOLEDO, and we will talk to you soon. Hey, Tashobia, how are you? And thanks for joining in. Please watch the video and share it. All right, y'all, until next week for the next Talk with the Doc session, I'm Dr. Nicole signing off. Have a great day. Bye-bye.